Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you the 70th edition of our COVID-19 community briefings. Today is November 6, 2020. I'm going to jump right into the Sioux County statistics, and I'm just, spoiler alert again, the numbers are way up everywhere. And so here we go. Sioux County, 2,810 positives. Of the 10,222 tested. That is a 27.5% rate. We had 139 new positives since we talked on Monday. I should also mention that the numbers I'm going through were as of the Thursday evening, coronavirus.iowa.gov. I downloaded all that information last night for an earlier morning briefing today. The 27.5% positivity rate in Sioux County compares previously to 26.8 and 26.2. So we are continuing to go up. 27.5 is a pretty high number. It's not as high, not the highest in the state, but it's up there. Our 14-day average in Sioux County is number 5 in the state at pretty close to the same thing as positivity rate. It's 27.2. Previously, the 14-day average has been 23.3, 20.4, and 19.8. So again, we've seen a steady incline in that number 5. By the way, Wayne County is number 1 in the state of Iowa in the 14-day average at 34%. That's a really big number. O'Brien County, number 6 at 26.8, previously 25.7, 23.2, 20.1. Again, this staircase up in all cases here. Plymouth County is number 7, 26.3%, previously 23.3, 20.7, 20.7. Lyon County, 17th in the state, but still over 20%, 21.1%, previously 18.7, 17.5, and 16.9. So the 4 counties that we talk about the most on these briefings are number 5, 6, 7, and 17 in the state regarding 14-day average. The stat that, again, is alarming to me, or impressive, I guess is another way to look at it, is the number of counties 10% or higher. That number back on October 19, not that long ago, a couple weeks, was 44. So 44 out of the 99 counties had 10% or higher positivity rate. That number today is 96. So more than doubled. We go from 44 out of 99 to 96 out of 99 at 10% or higher rate. It is all over. There is no question about the surge that we're in right now. Stepping up to Region 3. 148 hospitalized currently in the 20-county region in Northwest Iowa. Those numbers previously, 139, 124, 112. So stepping up again. We have 25 patients in the ICU in the 20-county region. Those numbers previously were 20, 20, and 20. So we did have a little bit of a jump there. Of the 25 in the ICU, 10 of those patients are on ventilators. There have been 24 admits in the last 24 hours, which is a higher number as well. In Iowa, we've now topped the 1 million test mark at 1,007,744. Of those million tests, we've had 141,772 positives. That's a 14.1%. We've had over 10,000 more positives since Monday in Iowa. The 14.1% state positivity rate compares to previous numbers 13.4, 12.9, and 12.4. Whenever you have 1 million tests and those numbers are climbing at 0.5 percentage point plus per day or per every 3 or 4 days, that's a big number. It's a big number of positives. So 14.1 state of Iowa. Number of hospitalizations in Iowans hospitalized in Iowa is 726. Those numbers, that's 102 more, 102 more since Monday. The numbers when we talked on Monday were 624, previous 564, previous 499. So 499, 564, 624, 726 within a 2-week period of time. Sioux County is number 12 in the state at 12 residents hospitalized somewhere. That's doubled from when we talked on Monday when we were at 6. So 12 Sioux County residents are hospitalized with COVID somewhere. O'Brien County, 4 residents are hospitalized. That number previously was 6. Plymouth County's 8. That number previously was 6. Lyon County 1, and I believe that number, just a minute, that number was 1 previously also. Woodbury County dropped a little bit, minor victory, from 43 to 40. So they're currently at 40 today. Polk County, number 1 in the state, going away at 71. That's the highest number that I've seen since doing these briefings, I believe. They were previously at 57 on Monday, and they're now at 71. So clearly hospitalization rates are going up as well. We've had 70 more deaths since Monday. The number is 1,803. Sioux County now has 20 official deaths. There's no change in the demographic in terms of the folks it's affecting the most. And again, that is 61 and over 90%. So those are the stats today, a little sobering. There's no question this thing is flaring up all over, and it's not just Iowa. I want to talk a little bit more about a couple things locally. I know yesterday morning, I'm going to get to this. Yesterday morning we had, at first check, 17 inpatients. 8 of those were COVID. I haven't heard or seen the number yet this morning. But there's a rumor going around that I want to dispel, and that is that Orange City area health system nurses were being forced to work if positive. That is absolutely not the case. That is not true. You know, it is possible, however, because it's possible to do that as a healthcare provider. It's not possible that we've done it. But you are allowed as an essential worker, if there are no other options, healthcare workers can work with N95 masks, proper eye protection, proper PPE. They're allowed to. We call that the nuclear option. I know some in our areas have had to do that, particularly in nursing homes, just because there's nobody else left. But we have not, and I repeat, we have not forced anybody to work who was positive. In fact, we won't allow them to work if they're positive. So that is a rumor that we want to dispel right away. The Governor Reynolds yesterday gave a press conference, and I want to talk a little bit about that in terms of what we're seeing here and what's going on. There's no question that there's a strain on the collective health system. It's obvious. Staffing is short all over. After 8 months, the fatigue is very real. We have great therapeutics now to help people to treat this thing, but we can't do that if the health systems are overrun. Sioux Falls, as an example, had 200 inpatient COVID inpatients on Monday, 200. And again, as I mentioned, staffing everywhere is in short supply. We need you and are asking you to do your part and help flatten the curve. Again, when we say that, we're saying slow the positivity rate. We're not going to stop the positive rate, but we can slow it. And the way we slow it, again, is broken record time. Wear your masks, avoid large groups, wash and disinfect your hands. Please, we're asking you to do that. Doing so will slow the rate and allow health systems to have room to take care of everybody. Again, we have great therapeutics today. People are recovering. It's a minor percentage that requires hospitalization, but when we have this many infections, even a minor percentage can overrun health systems as well. So we ask you to do your part and Doing so will also reduce the risk or the rate of infection for our staff, which we definitely need to care for ourselves and for you as patients. So thanks in advance for your willingness to consider that. Just a note for next week. There will be no briefing next week. I plan to be at an undisclosed location. I will not be around next week, and so there will be no briefings next week. We will look again at a week from this coming Monday when we come back and give you an update, hopefully with much better numbers. So again, we'll close by saying stay strong, stay vigilant, and above all else, stay healthy. Thank you.